say we're going to take this knee, slide back a little bit for me. Osteoarthritis of the knee, again, we're not going to change the integrity of the joint. We're not going to regrow their cartilage. It's not going to fix the problem, but providing a little bit of support and compression can give them a little bit more comfort, especially if you're trying to promote them doing rehab. Then giving them these taping techniques can make them feel more comfortable doing their rehab, or also be an indication that maybe they need to get a brace. So what we're trying to achieve here is providing a little bit of support underneath the patella for like a chondromalacia patella, and then we can also support the meniscus if they want it as well. So for this tape job, start with some tape spray. And put on our handcuffs. Now it's important too that you educate your patients as well. This is not going to fix the problem, but hopefully it will promote them to do the rehab. And one thing I always tell my patients, if you have osteoarthritis, try to avoid the open chain, because they want to strengthen their quads, but try to avoid those open chain exercises where you go on those universal machines and just extend your legs out like this. That's just creating a large moment arm on the patella, and it could almost worsen symptoms. So I try and promote more closed chain exercises with them. Okay, so we're going to start at the eyelet of the knee, and we're going to come upwards. So the eyelet's right under the kneecap. I usually have a fan going. Okay. And come up under the eyelets, on the side there. And again, these are minimalistic tape jobs. You could use a lot more tape, but I'm showing you how to do it and save supplies while still achieving the same effect. So we go to the eyelets right under the patella, and we're going to hook on our AC tabs. And then from here, we're going to try and provide a little bit of support for the patella by tracking it and compressing it. We can even come this way as well, more medium. Hook onto our tab. Again, we're going to pull it upwards. We should see puckering in the tape, and that's normal. It means we have good tension on there. Okay, so now we've supported the patella from underneath, and we've got it on both sides, so it should help it track a little bit better. And then also, if you've got a little bit of chondromalacia, hopefully it'll take off some of that tension. Now, if this person was younger athlete, they didn't have osteoarthritis, they had more of a jumper's knee or a patellar tendinopathy. Another thing you could do is support that area. So you could provide a little bit of padding here, or support under the kneecap with your foam pad, which we're going to do. And you can also dissipate forces as well by trying to come down more on the tib tube or the insertional component and providing compression. So in that sense, you could put an AC tab there. Or one thing that is taught, I know in a lot of textbooks, is if you roll up your tape in a spiral fashion and come right along tib tube, or just proximal to tib tube, hopefully you provide a little bit of an alternate compression point and dissipate some of the forces in the patellar tendon itself. And then you can come right on top and tape downwards. Now, if you really wanted to provide that extra support, this is where your foam padding will come in helpful. Can you pass me my heel and these pads as well?
Based on the same rationale, would you maybe do that for a kid with Osgood?
Yep, Osgood slash.
Can you do the first one that you throw away for just someone who's having a tracking issue?
Yeah, we'll get into McConnell type taping in a sec though.
Okay.
So you have two options here with a patellar tendinopathy. So we've got that band there to kind of translate forces a little differently. You could put a pad directly under the knee to give it a little bit of support there as well. Or you could take, if you don't have a pad, you could take your heel and lace pads and you could fold them over and you could create a little C shape underneath as well. And if they feel better with this, then it could be an indication that, you know, perhaps they would benefit from a brace, because that's exactly what the braces do. They have a little C-shaped foam pad underneath that support the kneecap, and they help the patellar track, and they also provide some support to the patellar tendon itself. So I would just take zinc oxide. Can you hold that there for a second? Because again, this is nothing structural, you just need to keep it on. So I would just keep that on with zinc oxide.
When you say a brace, let's say they did benefit, what type of brace? Would it just be a regular pencil with the open kneecap?
It would be a patellar tendinopathy brace that had the C-shaped foam in it.
Okay.
Yeah. So here, I would likely want to get him standing up on the table. Do that slowly so we don't pop the tape off. Okay, because we want him to contract his quads, because anytime we seal a tape job, we want him contracting his quads, because we don't want to cut off any supply here. So usually what I'll do is if I'm sealing, I'll start superior and come down low so that I'm sealing over top of myself. And you could come again in a figure 8 motion.
Yeah.
You want it? Bend a little bit more for me. Okay, and then that seals everything nice and tight. So keep in mind this is 2 tape jobs in one. This is osteoarthritis and a patellar tendinopathy. But if we were just looking at the patellar tendon itself, you could track it this way and provide the padding. It's up to you, or you could just put the pad on. So now I'll get you to do a full squat. You check when your tape job's done, see how the symptoms are, and if they say, yeah, that feels a lot more secure. My kneecap isn't hurting as much. It feels a lot better down the insertional point here. Any type of enthesiopathies as well. Then you know it's doing its job, and they're good to go. Okay? So that was 2.